Well, right now, growing concern tonight about the mental health of children. Kids 8 and up are now recommended to get screened for anxiety.
News specialist Jed Bowl is live to tell us what this important is all about for the community, and parents should know.
Yeah, I spoke with a child psychiatrist at Huntsman Mental Health Institute who's also a pediatrician. She likes the idea of these earlier mental health screenings because that's a way that they can get help to the child sooner if they need it.
The earlier you can identify these illnesses, the better off you are.
Dr. Christy Kleinschmidt tells me more than 50% of mental illness begins in children earlier than age 14 and can get worse over time. Earlier identification may help some children avoid debilitating anxiety and depression that makes them fearful of school and other social situations. Kleinschmidt says earlier treatment can improve the child's wellness trajectory.
I think it's only fitting that we could start to ask those questions during those well-child visits, or even those, stomach ache and headache visits that kids come in with, just to make sure we're not missing the early signs of depression and anxiety in our kids.
Left untreated, anxiety and depression can continue into adulthood. What should parents look for?
And the younger the child, they're not going to say, wow, I'm really nervous or worried about this. Instead, they're going to want to avoid things. They might have headaches. They might have tummy aches. They might insist on things going a certain way.
Or have trouble sleeping or show too much concern about typical childhood fears.
The earlier we treat this, the more we give hope that these are treatable illnesses.
Parents can create an ongoing conversation with their kids that is open, curious, and positive.
Gosh, I'm curious, what's going on? I'd like to talk to you more about this. Some kids, will say they feel sad or really irritable. I wonder if you've been feeling that way too.
And Dr. Kleinschmidt tells me that these mental health screenings will be new for the workflow for some pediatricians. She says that parents should arrive at those next wellness checks ready to ask questions about those screenings. For Live at 5, I'm Jed Bowl.